Hi, I'm Dr. Josef Witt-Doerring, a board-certified psychiatrist specializing in identifying and treating psychiatric adverse drug reactions. Today I'm joined by clinical psychologist Dr. Lynn Berg, who will share her inspiring recovery story after being medicated for over 25 years. Nearly a decade ago, Dr. Berg successfully tapered off her medications, and since then she's felt progressively better each day. In this interview, she reflects on the mindset of being medicated, the paradigm shift that empowered her to take control of her medical care, and the many challenging side effects that contributed to the prescribing cascade, a topic that's frequently discussed on this channel. This is a story with a happy ending, offering encouragement to anyone who needs it today. Now, let's go hear from Dr. Berg. Hi, I'm Dr. Josef Witt-Doerring. It is my pleasure to be joined today by Dr. Lynn Berg, PsyD, and we're going to be talking about what it's like coming off psychiatric medications after, I think it's 27 years. And Lynn has graciously agreed to come on and share her story with us. And so, Lynn, thank you so much for being here today.
Thanks for having me.
And so the place I usually like to start is, could you just share with us, how did you end up taking psychiatric meds in the first place?
I was about 25 years old or 26 years old, and I was seeing a therapist after undergoing a sexual assault where it was a pretty severe event. I was held hostage for a while, and it was a difficult thing to recover from. But about 3 months into our work together, she said, you're not really getting better fast enough. You should be feeling better by now. So go see this doctor. And I went to see this doctor, and he said, I can make you feel better. I had what people would call depression off and on throughout high school and college, just life events that I struggled to sort out very well. And I didn't like feeling bad. And it was just like hearing this is a wonderful thing that's going to happen to you. You're going to be able to feel better now. And that just kind of opened the door to my psychiatric medication experience.
And how old were you when all of this started?
I was 26, I believe.
Was it helpful? The medications when they got started?
I think I did feel some relief from some of the symptoms. The first one I was on was a tricyclic antidepressant. This was before Prozac was widely available, and it made me super, super drowsy. They think they now use that one for sleep med, trazodone. But then I was put on another tricyclic, and I think I started to feel a bit better. In hindsight, I think there were things that weren't feeling better, but I believed it was making me better. So I was all in because they told me, there's something wrong with your brain. We can fix this. So I'm just going to do what the doctor tells me and stick with it. I think I ignored some side effects I was having at the time, which is kind of a theme throughout the couple of decades. But I believed it was helping and continued to take it into my first pregnancy, which was a few years later.
You mentioned you were, looking back, that you may have been having some side effects that were missed at the start. What type of things do you think were happening?
Well, I think my anxiety really amped up. I was always a bit of an anxious person, but I started, again, it was hard to clarify because I was recovering from this traumatic event that caused a lot of anxiety as well. But I began to become agoraphobic. I remember being in a big museum and feeling the need to just go hide in a corner. This is 2 or 3 years after the assault. I began to think a lot about death. I didn't think about killing myself, but I thought a lot about death. I don't know that was my natural way of being in the world. Again, I sort of attributed it to, I'm just not over this assault. And then I was just really irritable a lot of the time.
Mm-hmm.
So again, is that me? Was it the results of the assault, or was it the medication? I'm not sure. But I think that the amped up level of it makes me think it was somewhat related to the medication. And then the other big one was fatigue, just being so tired all the time, which is not a typical thing for someone in their, mid-20s to feel.
Yeah.
And that is something that has been hard. I think that's just sort of characterized a lot of my adult life and I think it started then.
I think 27 years on medication is a long time. Can you just share your story? How did this unfold, after the tricyclic that you got put on? I mean, how were medications used during that time and perhaps towards the end? Share a little bit about when you started to suspect that maybe the medications weren't helping you.
Because I'd felt bad in a variety of ways for a lot of my life, I was really hoping they would make me feel better. So I think that made me think they were feeling better. I was feeling better. Mm-hmm. I also think I bought into this idea that I'm an object that could be treated by a professional, and that the professional could figure out things about me and my life that I didn't realize that I could have figured out for myself, but I sort of handed that over to the doctor. So that being said, I'm thinking I'm feeling better. I get married. I have a surprise pregnancy. Unfortunately, my daughter was exposed to Prozac in utero for a few months because I wasn't aware of the pregnancy. But then I stopped the Prozac, but then after she was out and living and I was breastfeeding her, and we're about 6 months in, I started to get what I thought was depressed again. So I was so committed to the idea that I had something wrong with me and that I needed treatment that I wanted to breastfeed her and get back on the medications.
Mm-hmm.
So I went to the extent to where I found a psychiatrist to prescribe another tricyclic while I breastfed. That's how much I believed I needed help. And I look back on that as a huge error, but at the time it made sense to me. So,
how so? What was it about that that stands out to you as a big error?
Well, my mother-in-law, who was a very wise woman, my then mother-in-law, she said, maybe you should look at changing something in your life to make it better as opposed to getting on a medication to solve the problem. I mean, she just said it.
Mm-hmm.
And I didn't listen.
Mm-hmm.
I just didn't see that as relevant to me. I thought I was broken. Mm-hmm. And that it was just something that was happening to me. I didn't see that there is a connection between the choices you make and how you feel. And I really regret not listening to her.
And when you look back at your life now with this new lens that you have, what things do you think that you had missed? Things that I guess you had said that, you'd sort of outsource things to the psychiatrist, that you were something to be fixed. When you look back on things in your life, what did you see were the problems?
I think feeling what you would call depressed felt like a problem. That feeling of powerlessness, not being able to get things done. I had an eating disorder issue that kind of has floated in and out all these years, kind of feeling helpless in the face of that, feeling like I wasn't accomplishing things professionally, but mainly just feeling bad, just feeling bad to be alive. It was just hurt to be alive. And then, and I would say that I did have some of the after effects still of what happened to me in the assault. Like, I do think that I had they weren't calling that kind of thing PTSD back then for people who went through assaults. But I think there was a lot of grief and just a lot of stuff that kind of got a little bit frozen there for me.
And Lynn, when you look back at that time now, what do you wish had happened instead of, I guess, going to the psychiatrist? If you had a redo, like how do you wished it would have played out?
I wish that therapist had spent a little bit more time with me sorting through what my issues were and just giving me some more time to help me see that I could sort things out for myself with her, her help. Like, I just wish so much that she hadn't, because I remember feeling surprised, like, what, this isn't fast enough? Like, I didn't quite get that. I didn't realize there was like a race or something, that I had to get better by a certain time. I kind of thought we were exploring, or I didn't realize I was so bad off that she thought I needed extra help. I wish she was a very nice person, and I know her intentions were good. She was part of the whole move towards antidepressants. The whole culture went through it. But I really wish that she had just stuck with me, given me more time.
Going back to that time period, okay, so you just had your surprise pregnancy, you had having some depression, you start medications again. Walk us forward from there. How did things play out with medications moving forward from that point?
Well, I think it's pretty common for people to be on a medication, have it help for a while, and then it's not really helping all that much. I remember going back on Prozac after I stopped breastfeeding, and then starting at, I may be wrong on the milligrams, but something like 20, then going to 40, then going to 60, then going to 80, when like you're over what's normally prescribed and you're still not feeling good enough. Okay, let's try another one. So you try that for a while, things are a little clearer, you kind of get a little bit of a rush from that, and then eventually that kind of stops helping all that much. And I think that eventually some side effects from the medications themselves became treatment issues, like getting a little bit hypomanic, some compulsivities, getting even a little bit worse, weight gain, significant weight gain eventually, which cause body pain, which then you're getting kind of treated for kind of a fibromyalgia type issue. Sleep issues are coming up. There's you don't always take the drugs perfectly, so you're having side effects from interdose withdrawal effects, and it all, and you just keep going back to the same person saying, help me, help me, help me, and that person's trying to help you with this drug, that drug, this drug, that drug. And I don't know. Where did the decades go? I just can't even believe that I let all that happen to me. That at some point I didn't say, wait a minute, this isn't working. There's something wrong here, and just saying, get me off of this. But I didn't think that. I stayed on that cycle for a long, long, long time.
Do you feel like you accumulated additional diagnoses from medication side effects? It is a story that I've heard sometimes. Yeah.
Yeah, I think you could say I am a person who would tend to feel more pain if you look at pain as kind of a repressed emotion result. But I think being overweight from the meds added to that problem with pain. I had polycystic ovary syndrome types of symptoms from the weight gain, which then triggered a whole series of medications and treatment by a kind of not very good OB-GYN. It put me on massive amounts of estrogen, which caused me, ultimately, I had a hysterectomy because of all of it. I don't think any of that would have happened if I hadn't been on those meds that made me gain the weight, which I think ended up being kind of the mood stabilizers. The Neurontin that kind of got layered in when I started having some hypomania. But I think the hypomania came from different SSRIs. I can't know for sure, but I suspect that was part of that, what happened there.
What was the most amount of medication that you were ever taking at one time during this period in terms of the psychiatric meds?
I can't be super specific on that, but I remember going to the pharmacy and the pharmacist looking at me like, I had, I don't know, 4 or 5 different meds, probably a sleep med. The restless leg medication. That was the other big thing that ended up being, that's sort of the end of my story is the restless legs playing out. Mm-hmm. Then probably 3 psych meds at a time was pretty common.
Wow. I
ended up on lithium for a short time, thyroid medication, like all kinds of stuff. Again, I'm just like, I'm an intelligent person. I still have a lot of regret for not listening to some of the warning signs. And I had a family member come take me aside and say, do you want to go somewhere and get off your meds? This was somewhere in the middle of all that. I'm like, what are you talking about? Like, why would I get off my meds? Like, I didn't see what was happening.
What do you think they were seeing that made them say something like that to you?
I think the weight gain.
Yeah.
I think I was in between marriages and I was a little bit ungrounded.
Mm-hmm.
I wasn't getting a career established. I was flighty, just not the direction you would have thought I would have gone in life. Mm-hmm. And just disconnected, I guess, from things. And I think that's probably what she saw. But I heard it later described as medication spellbinding, but like you get kind of in this spells cast almost, to use ancient language, where mm-hmm. you're not in touch with yourself because you're like in a padded room, but in your own mind. You're not getting the real information coming in because the meds are clouding you. That's what that's how I sort of explain it to myself. Yeah, and I drank alcohol too. I wasn't. Mm-hmm. I was a social drinker, and that of course didn't help the medication work any better, and probably exacerbated some of it. So, and I take responsibility for that as well.
Lynn, how did this? Well, let's stay with the language. When did the spell start to break? When did you start to suspect that maybe the medications weren't helping you? What was that story?
Well, there were certain things that kind of peaked out here and there. Like one time I had a severe reaction to not taking a medication for like 3 or 4 days. It was called Effexor. Mm-hmm. And Effexor was a drug that didn't have the time release version yet. And I just left it behind. I went on a weekend trip and I got so severely ill from that I almost went to the hospital. I was so sick in my stomach and felt so terrible. And then I realized it's when I finally got back to the medication and I took it that I was okay. And I remember going to my doctor saying, I had a reaction from not taking this medication for 3 days. And he said, oh, no, that's not possible. That didn't cause that. And I kind of was like, wait a minute. This isn't true based on my experience. And I began to kind of get a little bit of a doubt in my mind as to what the information I was getting, whether or not that was accurate. I also think the biggest thing was when I had a headache for about a year. I'm very tolerant of headaches because I've had them all my life. But this one was just not going away. And I finally went to an ear, nose, throat doctor. And he said, oh, it's your medication. Mm-hmm. And I said, what? He said, it's your Wellbutrin and your Adderall. I said, what? He said, stop the medication. Your headache and your jaw pain will go away. And I was like, what? And so, of course, I thought those drugs are a bit activating, and I felt like that was maybe the best combination I was ever on. But I stopped those drugs, and yes, the headache went away and the jaw pain went away. And then I went and saw that jaw bruxism or jaw TMJ is a side effect of antidepressants. And I was like, what? Why didn't anybody ever tell me this? I'd had thousands of dollars of dental work done, all because of the jaws clenching. Well, no one told me ever that antidepressants could cause that. So that was kind of...
I'm just going to jump in there because this is such an unrecognized problem with the antidepressants and the teeth grinding and also the dry mouth. So many people I hear, they'll start some of these meds, they'll be on multiple of them. They never had a lot of cavities before, but then when their mouth dries up and they start to grind, they'll start having like 10 cavities a year. I don't know why it happens to some people, but it is something that is missed a lot because people don't usually think about dental work and, the dry mouth and the teeth grinding from the antidepressants and how that can make you vulnerable to cavities and such. So I think that's really interesting you mentioned that. I'm
sure I knew when I had the dry mouth with different medications, I'm sure I knew that it had to be related to the medicine. But I don't think anyone ever said to me, that's a serious side effect. Let's look at your dental health. Let's make sure you're not hurting yourself by continuing this. But once I saw that in writing, like when I went and looked it up, it's like, what? That's when I think I began to, like the veil was pierced, or it's not the best metaphor, but that's when I began to be more suspicious of what was happening. And I began to kind of sporadically try to stop things, try something else. And I eventually stopped drinking alcohol completely, and I began starting to see that I had to take responsibility for my own health. But there were some bad moments when and I kind of knew you needed to do it slowly, but I was just cutting up my pills and, just kind of getting off of stuff. And I would, I had some pretty bad experiences with that would lead me to go back on.
Yeah. Give us a play-by-play of that, because I think coming off meds after, over 2 decades, that can be pretty tough. What was the journey like from when you decided to come off to when you eventually got off?
Well, like I said, it was sporadic at first. It was I felt a little bit hopeless and afraid because I felt like maybe I was never going to be happy, or, maybe I felt like it was like I had to do it because the side effects were so bad, but I didn't really have an answer for how I was going to live without them or without that new. I didn't have the vision of, I can do this myself yet. But I remember one night for some reason, I just decided I wanted to stop whatever I was on. And I remember driving, I overshot my exit home by 30 miles before I realized it.
Yeah.
And then I got home and I went in my closet and hid in the corner. And that's where my husband found me when he came home. And it didn't seem that weird, though.
Yeah.
It was, it was like it was happening, but it just seemed like I was a little surprised I went that far past my exit. I felt kind of stupid, but it seemed like it made a lot of sense to go get in the corner of the closet. And and I remember going to my doctor later, and he's like, well, after being on these medications for so long, it's, your brain's probably used to it. And, that probably had quite an impact. And let's see what else we can put you on. Let's do this again. Let's find something else. Which I think eventually led me, I was pretty much off the antidepressants, but I was still treating the Adderall with the ADHD. And then I was having severe anxiety. So I went on Xanax. In my last couple of years of graduate school, I was late to my graduate school. I was getting a doctorate. But I think probably some of that intense anxiety, which was exacerbated by being in grad school, but I think it was probably also coming off this antidepressants. Mm-hmm. Like, I think I was having cascading symptoms of going off of everything that then triggered other things. Then that's why I was on the Xanax for a while. And I think I was on Xanax. It wasn't much, but I would just like take the Adderall to focus and then the Xanax to come down. And at some point I realized, like, well, what kind of a cycle am I in? I'm just speeding up and slowing down. Like, what's that going to get me? That doesn't make any sense. And I think about that time as well, a little before that I stopped all alcohol and was exposed to some thinking about that, which was just very self-empowering and very much like you're responsible for your life. You can make choices, you can make changes. And I think, you know, that kind of all added up to me weaning off Adderall's not that hard to get off of, but I weaned off the Xanax. And then I was just left with my restless leg medicine.
You know, one thing that I want to point out is most of the people that I speak to on this channel develop protracted withdrawal when they come off, and that's a really uncommon reaction, but it is covered widely on this channel. From the sounds of things, you were able to come off after many years, and it doesn't sound like it was easy, but it didn't sound like you came out, you know, with neurological deficits like a lot of the people that I talk to have. Is that a fair read of the situation?
Well, what I don't know is what I experienced in those later years of the process is I did experience what I would consider to be a lot of cognitive issues. I could not add, like I was learning how to do psych testing and had to add up a column of simple numbers to score a test. I would have to create spreadsheets just to add 4 or 5 single digit numbers. That's how insecure I was about my cognitive abilities. And I think that in hindsight, that might have partly been due to going off things. Yeah, maybe it was extreme anxiety, but maybe that extreme nature of the anxiety was related also to coming off the meds. I can't say for sure that's the case. But I did feel pretty confident about my ability to get off those meds. I was proud of myself. What I didn't know yet was what was ahead for me with the Mirapex or getting off the restless leg medicine, which ended up being the worst part of everything.
Okay, well let's go there. Tell us that story.
So restless leg syndrome is an experience people have when they're either sitting or lying down or trying to sleep, where you feel like you need to move your legs, and there's just really strange sensations in your legs that kind of require you to move. It's kind of like the akathisia you talk about. And maybe there's a lot of overlap, but I began having that restless legs syndrome between my pregnancies, and I never connected it to the antidepressants. So I sort of saw it as a separate thing that I just had that needed to be treated. And it got so bad that it felt like life, like every night was a nightmare. It felt like I was going to hell every single night. And in hindsight, that is something that's caused by SSRIs for some people. So I think it was the meds that caused it. And so eventually I found a doctor, and he said, I can give you this medication. It's a Parkinson's drug and it'll help. So I'm like, please help me. I'm desperate. I don't know how I can go on with this. So I started taking that medication, and it solved the problem. I took it every night. But what they didn't tell you is that eventually, for many people who take that medicine, it causes something called augmentation, which means that you have to take more of the medicine to treat the symptoms of restless legs, but that eventually it actually causes your restless legs to get worse. So I get off all the meds, but my restless legs are getting worse and worse and worse, even with the Mirapex. And that, I hear people on your webcast, your podcast, talking about akathisia. And that's what it reminds me of. It's like anytime you're going to go to sleep or get on an airplane or have to sit still, you're going to know that this is going to kick in. And the medication you've been depending on for all this time is not working anymore. But yet, if you don't take it, you're in even greater hell. And I saw no hope to get off of it. I would be reading about people who would be awake literally for 7 days and 7 nights before they could, when they were trying to get off of it. And it kind of became it became a nightmare again. And so here I was off on my meds. I was so proud of that. And I was still having just this, like, every night kind of a nightmare coming up. So I went to Stanford Medical School, or the Stanford, hospital system. Saw a sleep guy there, and he's like really, really nice. He's like, I can get you off this, but you have to go on methadone to get off of Mirapex. So I'm like, okay, great. Because this is killing me. This is like, save me again. And so I went on the methadone and weaned off the Mirapex. And then he's like, well, you can stay on methadone for like 20 years. It's fine. And I'm like, okay, I guess I have restless legs. It'll never get better. This is what I'm consigned to. Eventually, I started having side effects from the methadone. I was only taking 5 milligrams, but I was having severe stomach side effects. And then I went to a talk one night about the side effects of opioids, and it talked about the gastrointestinal problems people were having. I'm like, oh my gosh, here I am again. I'm on another medication. I'm having terrible side effects, and I just bought into the whole thing again. And now I have to get off methadone. Well, I got off the methadone, and eventually, guess what? My restless legs is so much better now. I still have it. It's very, very light, though. But what I didn't realize is between getting off the Mirapex and the methadone that I was going into something that I think is called dopamine agonist withdrawal syndrome, which I actually stopped having feelings for 3 or 4 years. I was living my life. I adopted a daughter through the death of someone in her family. I had a new husband. I was going through life, and I couldn't feel anything. And I didn't even realize it until I was 3 years in that that's what was happening. And that to me was the greatest tragedy of all of this was that the loss of that time. I could do very little but take care of my daughter. I've had to pull out of my postdoc program. I just would get up, get her off to school, come home, go to bed. I got married. I loved my husband, and I knew that I loved him, but I couldn't feel it. I loved my children. I knew that I loved them, but I couldn't feel it. And then I just woke up one day. I'm like, I don't feel anything except bad. And through my will and desire to live and my belief system, I'm pushing through. But I got off of that, I think, in 2016, and it's 2024 now, and I feel like I'm just now on the other side. I feel like it's taken me that long to heal.
Yeah, I take it back. I mean, at least in terms of the protracted withdrawal stuff, I mean, it does sound like, I wonder how many people with restless legs actually have it just because they've had neuropathy from the antidepressants, and you're right, because it is like akathisia. It's this feeling that compels you to move, and I know some people get it in their chest, in their body, and it can happen just in the legs, and so I think. It does sound like you were really suffering from some legacy effects of these medications. And then, to come off Wellbutrin, Adderall, and Mirapex, all strong dopaminergic drugs, kind of consecutively, and at that level of, a lot of people will describe feeling really flat when they come off stimulants, like no desire or joy or motivation. So I guess I'm curious, was it more of that no drive, or was it more dissociative, like I feel disconnected from life, or maybe a bit of both?
Oh, I think dissociative is a good word, because I forgot to add in that I got so severely anxious, and I think a bit dissociative. And I especially noticed it because prior to withdrawing from the Mirapex and eventually the methadone, I was really into dancing tango. Like I was like super, super into it. And in the midst of that, I noticed that while I was dancing, I started to float, and I could not feel connected to my body. And I felt like I was dissociating. And I think that I started to have trouble driving over the bridges here in the Bay Area in California. I stopped dancing tango. I stopped riding horses. Every single thing I did caused me so much distress. I just withdrew. So I would say that dissociative aspect of it has really just ended in the last couple of years.
I'd like to ask you a little bit about how has your mental health been since coming off all of these medications? Where do you find yourself now as opposed to when you were back on the meds?
I feel so much better.
Mm-hmm.
I have to work at it. That because I work at it, and because I'm so grateful to be free. I feel like my mental health is just so much better. I get down sometimes. I get anxious sometimes. I get discouraged just like everyone else. Life is hard a lot of the time, and it's wonderful a lot of the time. But I feel like that, and I feel like that was available for me previously. I just wasn't quite able to get there because I was under this spell of the medication, but also just this belief that someone else could do it for me.
Something that a lot of people struggle with when they start thinking about medications is, the whole idea that, what if I have a brain disease? What if I have a disorder? What if there's something just wrong with me and I just need to stay on this? Was that something that you struggled with when you were thinking about coming off, and, when things were hard for you?
Well, I guess by then the evidence was pretty great that even if that was the case, the meds weren't really helping. So I think that I did struggle with that. That's why I stayed on them for so long. But eventually the evidence was just clear enough that they weren't helping, and that the side effects were so much worse than I had ever imagined they would have been. It didn't matter anymore, I guess. But I definitely understand that. I definitely understand, especially if you've been helped by them to some extent, and especially if you haven't been on them for so long. I could see how you would be like in your 20s, someone gave you an antidepressant, you feel a little better. I could see why you would think, well, I don't want to go off of it because I don't want to upset anything here. Mm-hmm. But my heart goes out to people in that position because I have a suspicion that there will be side effects for them in the future if they stay on them for decades. And I worry for them that they'll be at a point at some time where they think they can't go off of it when really they could have. They have the right to go off the medication if they want. They get to. They don't have to go for decades on medication if they don't want to. And there's very good reason to think it'll be fine. And I guess that kind of is where I've ended up being kind of passionate. Whenever I'm in conversations with people, I don't want to offend them, make them feel bad. But I want to say, if you want to get off of these, you can. Just please go really slow and take advantage of all the information out there right now about how to do that.
Another thing that I'm curious about is when you reflect back on the 27 years of the medications and all of that, and I guess how you feel now, how do you think taking those medications affected the trajectory of your life?
Well, that's a kind of a hard thing to face. I feel like I lost my youth to the medications, honestly. I mean, all that development you're supposed to do, the natural course of your development. I can't blame it all on the medications. I participated in it, and there's no way to really know. But I sure wish that I had been more connected to myself and to the pulse and the rhythm of life that was available to me, that was just cloudy. I was all clouded by the medications and my handing over of my health and happiness to a system, as opposed to maybe sticking with some of the ways in which I was brought up to be problem solving and learning from experience. You have to feel pain to grow. If you're not really feeling the pain, you'd lose opportunity to grow a lot of the time. And I feel like as a result, I ended up just kind of done all kinds of things, but never really sticking with any one career. Partly because I wanted to give all my effort to raising my children. And that's another thing you and I talked about earlier that I wanted to mention, is that I even put my kids on these medications, with the help of psychiatrists. And that's something I super regret. That I feel like that changed the trajectory of their lives as well as my own. And again, I look at that as being kind of caught up in the whole story that society was feeding me and that my belief system, and I thought it would help them. But, I really regret that pretty much every day of my life, that I bought into the story so much. I advocated it for my own children. They're okay now, but I didn't even listen to them. One of them, she was put on an ADHD med. And she said to me, Mom, I feel kind of depressed. I think it's the medicine. And I said, oh no, I think you're just in 8th grade. Life's hard. You need this because you were having trouble at school. Well, I didn't know that depression was a side effect for some people of the stimulants or Strattera or whatever she was on. I didn't listen to her. I didn't see that life just brings problems. We have to sort through them. We have to solve them. We need help sometimes to sort through things, but we don't have to turn to medications to save us from life. I just didn't see it. So,
do you feel like being on medications affected your relationships in any ways, either good or bad, when you reflect back on important relationships in your life?
Well, yeah. I mean, I've had 2 divorces behind me. I feel like my emotional numbness interfered with my relationships. And the whole seeing myself as a victim interfered with my relationships. And I think the side effects of the medications interfered with my relationships. And people are very understanding of side effects. They're going to want to help you if you're hurting. They're going to be sympathetic if you're in pain. They're going to feel sorry for you because you gained so much weight. But it doesn't really help your relationships to be in those positions or to be the object of sympathy. I feel like it was just madness. It was just sort of this madness scenario I was in. And I think it affected my ability to make friendships. I think the agoraphobia kept me from getting out socially. So I didn't really have the kind of friendships and community involvement that I would have had if I hadn't been on the medications. Again, was it the medications or was it me? I don't know. But my suspicion is was exacerbated by the medications.
I wonder about that. I mean, relationships these days with so many people on these medications. And I think I told you about this. I mean, I've taken some SSRIs before, and obviously I know a lot of people who take them, professionally, but also personally, people who I've known and who I've spoken to. And I've seen some people just drift on them, that they get started on them and all of a sudden you hear from them a little less. And it's just something that I haven't put something together yet, but it is something that I think about. I wonder if there is something about the distance that the medications put between you and your emotions that can, I don't know, maybe make you less connected to people or less, I don't know, motivated to have close relationships. And so, I mean, they do all sorts of things with emotional blunting and such. And so I do find what you say really interesting. One thing I have to ask you about is, what was it like talking to your children after you were going through this journey of being like, well, I actually don't think I believe this story anymore. And, they might have been on that path as well at this point, or bought into it, or what's that like doing that 180?
Well, I apologize to them so much. I'm really lucky. I have amazing daughters who are very loving and forgiving. I had to watch my eldest kind of wean herself off in a very, very difficult fashion. I forget which antidepressant she was on while she was in college, and it was just so painful to see her go through that. And even at that time, I didn't really have the tools to say, you need to do it really slowly. I didn't even know so much about the withdrawal effects. And I'm just so grateful because now they're kind of evangelists as well out there for who maybe you don't need that medication, or have you thought about coming off of it? Or, my middle daughter is a new nurse, and, she's seeing kids get prescribed all these meds, and she's kind of just gently putting the message out there in her medical community about, like, maybe we need to rethink this, or maybe there's another way of looking at this, or discouraging her friends from just turning to meds first, just so I feel like it was really difficult, but that, they've taken it to a place that's going to actually helping the world. And we're always talking about how to say things without offending others or making them feel bad. Everyone gets to choose what they want to do in life. Everyone gets to choose the substances they take. It's not like we can decide that for people, or, people are going to go on their journeys. But I feel like we're all kind of united in that. And I was really grateful I went through that, because I had this wonderful experience of adopting a daughter who was 9 at the time that I adopted her, and to be able to help her go through high school medication free. Because, 30 or 40% of the kids in her class are on medication. So she's like, well, why can't I be on medication? Don't I have this problem? Like, what can't you give me this diagnosis or that diagnosis?
Is that for real? Or is that like an exaggerated number? Is that legitimately?
No, in her cohort, yeah. And
whoa.
Yeah.
Okay.
So I was so certain, no matter what her symptoms were or what difficulty she was going through, we're not going to get a diagnosis and we are not going to get medicine. If you want to go talk to a therapist who's going to like help you sort through things, that's fine. But I don't, I think, as a psychologist, I think it's, the whole system's kind of set up to send people to medication pretty quickly. And I just very careful about anyone I would ever send a child to, that you want to make sure that that's not their route that they're going to go.
Was your daughter's class like an outlier, or is this a regional thing? Like when you speak with other professionals or when you talk to other people in your practice about what's happening in their classrooms, are those numbers kind of in line for young girls and schools?
I can't say for sure, but I do think this to some extent is this, kind of suburban bubble in Northern California. I think a lot of children being seen as being vulnerable and having a mental health problem, and that and having a lot of anxiety, and people want to help them. So how do they just get put into onto these medications. And of course there's the ADHD bandwagon. So I find it very, very disturbing and sad, and I feel really fortunate. My wonderful daughter kind of bore with me with some of the trouble she was going through, and just now she sees how she can work through her problems, and we can sort through things, and it can be hard for a while, but then it's going to be better on the other side, and so I feel grateful. It's like I know what I did with the first time around, and I didn't repeat it.
So I want to segue actually to talk about your professional work now. So, you're working as a psychotherapist. What is it like working as a psychotherapist and having these views within your community? And also, I guess I wonder if patients are surprised by some of the views that you have because of previous experiences with other therapists and doctors. I just want to hear your perspective on that.
Well, I stayed out of the field for years because one, I was feeling so bad, but two, I just didn't see how I could be a psychologist and in the way that and not be kind of coerced into diagnosing and by the system. But I decided to go ahead and get licensed just because I'd put a lot of time and effort into getting the degree, blood, sweat, and tears. And I have found that, I'm going to be someone some people will want to work with and other people won't. I don't take insurance. I work primarily with people who don't have insurance and who are through this organization that connects therapists who are willing to take a lower rate. And so I don't have to give a diagnosis. And I kind of talk about that pretty much up front, that if that's what you're looking for, that's not how I see things. So you're probably going to find someone else. For people who are on medication already, I say that, like, if it's working for you, I'm really, glad about that. I want to, help you identify if there's any side effects you're having. I'm a good resource for that. I actually have told, some people our progress might be a little slower than it might be otherwise because the medications often make it a little harder to progress. And I see you as someone who is going through human experiences. I see you as someone who doesn't have anything wrong with you. You don't have a disease. I'm just very clear about that at the beginning. So some people aren't very comfortable with that, and they're not going to keep seeing me. But most people are really glad to hear that. A lot of people don't want to be on medication. And then if they are, and I say, if you ever want to get off your medication, then please let me give you resources to help you do it in a safe manner. So I think
you said something really interesting, and you may have heard this in your training, but I often heard it in mine. It was antidepressants and therapy are the strongest when used together. And you had just mentioned something that is counter to that, just that sometimes the medications can prevent, that they may make people move slow. So I just want to get your take on that, on medications and how you think they affect someone's progress in therapy, just your musings on that subject.
Well, my musings is that I was in therapy for 25 years along with the meds, and I'm telling you, I didn't make much progress.
Yeah.
I mean, the thousands and thousands and thousands of dollars I spent on therapy, and I think God bless my previous therapist for just watching me just go around and around in circles. And you can talk, I just wasn't going to be feeling the pain that life gives enough to make a change. It just comes through blunted. And the greatest changes I've made in life have come because of the pain I was feeling. And then it's like, I need to make a change. And guess what? I found the wherewithal to make changes. And I feel like therapy goes much better if you're getting to sit with someone who's going through pain and say, oh, wow, let's look at this. And wait, what are your choices here? Is there something you're adding to this? It's making it worse. Is there something that I need to help you think about getting help from others in your community? Let's look at what the problem is that you're really feeling right now. If you're not really feeling it, it's much harder to identify.
I feel like, because I advocate that as well. And I mean, what you said makes a lot of sense to me, but I feel like my colleagues would probably call me cruel if I was just like, we need to let there be depression, let there be anxiety, obviously not to a point where someone's suicidal or completely debilitated, but sometimes a healthy amount of it, enough of it to be maybe pretty disruptive to your life as well, to kind of, because that's just what it is sometimes.
I know, I agree. It does seem, I don't wish pain on anyone. I don't wish unnecessary pain on anyone, but life brings it. And if I thought that giving them the medicine and that would actually make them better, I'd be all for it, but I just don't believe it will. Mm-hmm. It's like a short-term possible solution with lots and lots of possible downsides that might delay, it's going to delay your progress, in my opinion. Now, if you're just coming out of childhood and, you're in a nightmare scenario because of how you were raised and you haven't, I understand it's even harder with someone who's, like when I was 16 and really struggling with my mood because of life circumstances more than anything else, I still don't think medication would have been the answer, but I think it's you need an even more delicate touch from the therapist to really empathize with the pain. In some ways, I think if I had just never walked in the door of any mental health professional ever in my life, I think I would have been better off.
Wow. Yeah. Well,
and I don't mean that's to speak ill of anybody who might happen to see this, whoever was a mental health professional for me. I appreciate all the work, all the love and care, and I'm sure that's an exaggerated statement. But when my first time I saw a psychiatrist I was having some stomach issues in college, and my dad's doctor said, "Well, it's in your mind.
Yeah,
you need to go see a psychiatrist." And I went to 4-day-a-week Freudian analysis in college, and I think I began to see, that was sort of the beginning of seeing myself as a victim or someone who needed to be treated. And I think if I had maintained the idea that I have a problem I need to get help fixing versus I'm someone that needs to be treated and cared for, I think I would have been better off. I feel like that was a fork in the road.
You mentioned this a few times, which I thought was interesting. Is that what you meant when when you're using the word victim, that it's a mindset that they instill within you that wasn't healthy for you in the long term. I was wondering if you maybe could just expand a little bit upon that.
Yeah, I mean, the word victim has a lot of connotations in our society, but I do think like I am the victim of a circumstance or the victim of my own brain, of a disease, of pain, and that I'm somebody who, or, when you have bulimia, which I had for a few years, you have this big bad thing that's happening to you that you need help with. You're a victim of this mental disease. And I think that I wasn't a victim. I think I was just having difficulties, because life is hard. And I think that seeing myself as an actor and a subject rather than an object of treatment, but a subject of my own recovery would have been more effective for me. So when I work with people, that's kind of where I try to go. It's like I have great sympathy for the problem, but it's like, well, now how do you want to move forward? What do you see as your options? What do you want to experiment with changing? See if it works. See if you can feel a little better if you change something. Versus, you have depression. This is hard for you, and let's treat it. Like you're the victim of depression. Well, no, you're an experiencer of life. Again, we're not talking about the far edge conditions, but I would say even with depression, pretty far edge depression, you can go pretty far with that. I mean, they say like one of the best treatments for depression is behavioral activation, which is essentially acting, taking steps, doing things to move yourself forward.
I mean, just calling it depression as if it is, it's a thing, like I think the way we use the word depression is like it's an illness, like a brain condition. And because you've got this brain condition called major depressive disorder, you have, low mood, anxiety, sadness, but it's like, no, those symptoms are what makes something depression. And the depression is not usually there because of this, major depressive disorder, mysterious illness coming out of the brain. It's, have a look around in your life. And we rob people of the opportunity to do that when we indoctrinate them with this very heavily medicalized model of how to see mental illness. And it's really disempowering. And I think that is a theme that you talked about a lot in your story about how that was taken from you, maybe a more empowering version of what was going on that would have spurred on change and growth sooner.
And I welcomed it in some ways because I felt so bad. And I remember being at a Borders bookstore in Dallas and finding a DSM on the bookshelf and like looking like, oh, this explains my problem. This is why I'm feeling so bad, and why people think I'm weak. I have a reason I can call it this. It felt like, oh, finally somebody gets how hard things are. And so I totally get like what a relief it might feel to get a diagnosis. I get it. But all these decades later, I just don't think it's useful. And that's why I haven't been able to get myself to take insurance or do anything that requires me to put a diagnosis on, because I just think there's so much a better way to look at it. Like, you're feeling all this. I see you. I get it. But that doesn't mean you have something. Like, it's not like you're a diseased person.
I want to actually learn a little bit more from you and get your thoughts on why do you think people like to latch on to labels? I get that there's a part of it that you mentioned nicely about, some of it's just validating wow, here it is in a book, and like I'm hurting and it's here and they're taking it seriously. This is real. I get the validation part of it. Are there other things that you think are going on psychologically that make just the concept of having maybe like a brain illness more appealing to someone than, I guess, the other version is, you are responsible for changing things, and things have happened to you in your life, some of them your fault, some of them not your fault in circumstances. So I want to get your download on that. How do you think about why people latch on to labels?
Well, I mean, part of it is that when they are in powerless situations, which can happen if they're in a bad marriage that they can't get out of, or in an abusive situation, or they don't have the monetary resources they need, that you can't do anything about, that it can feel possibly like better to have something that people are saying is treatable, because it's a concrete thing outside of the circumstances that seem impossible to change. Like, yeah, it's one thing for me to sit here and say, well, you have to change yourself and take action and all that. But if life circumstances are such, they're so hard, that might just be too much. So it might just be way easier to think of it as a thing that you have. That has a societally accepted way of treating. I get that. I understand that. And maybe that can work for some people, especially if they're not on medication, and then they can actually use some of the non-medication treatment techniques that people are offering that can be helpful, like sometimes changing how you think can make you feel better. Sometimes some of these manualized treatments may help some people. I think part of it is to feel like you're part of a group. I feel like that's a lot of what's happening with the kids is, I have ADHD, sort of explaining the awkwardness of adolescence and teenage years. Well, that's because I'm on the spectrum. I'm not saying that autism is quite the same as these other things, but some people use that as something they want to have. My daughter, people ask to get diagnosed with that. Or it's a way to get out of certain school requirements. I think that's one reason parents might want their kids to have it. Or, it's a way out sometimes. It's a way to get a break.
That's great. Yeah. Really, really interesting. I'm just thinking, as much as I'm interested in your personal story, I find myself just so interested in just your thoughts in general, just about psychiatry as well, which is awesome. It's great to talk with someone who went through it themselves, but also works in the field. Well, I don't have any further questions. But I want to ask, is there something that we didn't get to, which you think is that you want to share, or, that you want to share with the audience?
I was thinking about that. Like, what would I want to say? I would say to people to trust your inner voice, and listen to people who love you. If you're on a medication and you've thought about coming off, or you're thinking that you don't feel as connected to your life as you'd like to, I would say trust that and follow that. There is a way to feel more engaged in life. And I would say that, don't ignore sexual side effects. Don't ignore weight gain. Don't ignore your cognitive issues. Don't ignore headaches. Don't ignore more anxiety. Don't ignore these things and think they're just you, or just because you have a disease. Try to get someone to help you look and see, is this worse than I was before the medication? And just really look at it. Because I just would hate for anyone in this audience to go decades without figuring it out, because you have a whole incredible life to live. And I would just say, listen and get help, and try to find someone who's, if you want to work with someone in mental health, find someone who wants to work, has it in their, isn't going to want to keep you on meds just because that's the way that they think the medical system says it should be. Just if someone who's going to at least question that a little bit. Yeah.
Speaking of that, how can people get in touch with you if they specifically want your help?
Well, I was trying to get a website up by the time we did this, but I didn't get that up. But you can reach me at drlynnberg@gmail.com. Okay. Just Dr. Dr. and then LYNNBERG @gmail.com. And in the near future, I'll have a website up. I'm just sort of developing how I want to help people. I'm definitely happy to have conversations and just, consultations with people who are thinking either about going on or getting off meds. I'm doing some coaching, as well as in the state of California, working with people as a psychologist, and I do use a sliding scale. So if you want to talk, reach out and let's see what we can do.
Dr. Lynnberg, thank you so much.
Thank you very much.